As AI is integrated into our lives in new ways, healthcare systems are looking at how to incorporate it into medicine. WRAL health reporter Grace Haba was there as national and local leaders gathered for a forum to discuss some of the best ways to use this technology and to use it safely. Grace.
That forum was hosted earlier today here at Duke University. Now, along with members of the health system here at Duke, health and technology experts with UNC, Microsoft, and the U.S. Department of Health and Human Services all got together to ask the question, how do we as a country safely integrate AI into medicine? It's a question healthcare systems across the country are asking as patients look for answers. U.S. HHS officials say at the national level, safe integration of AI will require clear guidelines for how companies can use it.
The lucky thing, I think, for all of us is we're at the beginning of this journey, and so the opportunity to really engage with developers, with different types of settings in which this technology will be deployed is really critical to thinking about how we get into that level of detail and make sure that we get it right.
After the forum, health leaders toured this OR at Duke University Hospital. They focused on these black box cameras, which record everything that happens during a procedure.
And those sensors, they capture image, voice, video, and also some of the other data feeds that happen through anesthesia. And
after a surgery, a team goes through hours worth of footage to then talk about what happened. Health experts say the hope is to one day use AI to speed up that review process. They also say the tech could potentially help alert surgeons during a procedure of a potential problem with the patient on the table before they happen.
Those systems becomes more sophisticated. I think people should be educated and eventually have a license to utilize those systems, right? With the goal that the end is the human making the final decision based on the recommendation of the AI models, right? Because at the end will be our clinicians as a surgeon. That's my responsibility.
Exactly what the guidelines those companies and health systems will need to follow when it comes to AI in medicine remains unclear. But health officials say that those regulations, when they do come, will likely look different for things involving AI for a procedure or for a routine doctor's visit. Live in Durham, Grace Haba, WRAL News.